talk about some people that battle with cosmetic surgery addiction and treatment options. Jennifer Aniston, Iggy Azalea, Kylie Jenner, Kim Kardashian, Kourtney Kardashian, Julia Roberts, Kelly Rowland, Lil' Kim, Janet Jackson, Clay Aiken, and Michael Jackson, just to name a few. Everyone knows the media plays a huge part in shaping the image of what's hot or not, and celebrities, both male and female, medically change and alter their appearance, whether it be for health concerns or they're just plain unhappy with themselves. In today's society, we have this unnatural image of what perfect is, and us normal people know that the easiest and sometimes only way to achieve these looks is by going under the knife. But for some, this perfect image is essential for them to be satisfied with their lives. They will continue to get surgery after surgery until they are severely deformed or broke from all the money they spent on surgery. A person with a plastic surgery addiction may obsessively go from doctor to doctor until they find a plastic surgeon or dermatologist who agrees to treat them. Now, most people that suffer from cosmetic surgery addiction usually also suffer from body dysmorphic disorder, BDD, body dysmorphia, or body dissatisfaction. BDD is defined as a mental illness that involves an obsessive focus of a perceived flaw in a person's appearance. Now, this flaw may be minor, such as their nose is a little crooked or their eyes aren't the same size, or imagine they could see something that's not even there. Body dysmorphia will usually last for years or be lifelong, but there is no cure for BDD. And about 1 to 2% of the population suffers from BDD, according to the International OCD Foundation. And this, ladies and gentlemen, is Jenny. Jenny is 28 years old, and she has had a whopping 28 plastic surgeries, including a brow lift, Botox, 3 lip implants, cheek implants, veneers on her teeth, 3 nose jobs, 2 boob jobs, 3 breast lifts, and liposuction on her arms, stomach, hips, thighs, and knees. Jenny's total cost for all of her plastic surgeries is $80,000, and it started when her ex-husband told her that her nose was too big and her boobs were too small. Jenny admits that she still has low self-esteem, and she's very insecure and still sees a lot wrong with her body and wants to make more changes. She told her surgeon that in order to help enhance her perfect image, she wanted a Michael Jackson nose. He expressed to her that she could never have Michael Jackson's nose, and another surgery on her nose, totaling in 4 nose surgeries, could make her nose collapse into her face and they'd have to start all over from scratch. But Jenny told him that she was still willing to take that risk. And this is Cheryl. Cheryl admitted that she's addicted to liposuction. She's had a breast reduction, liposuction on her lower abdomen, love handles in the back, a tummy tuck, and tightening of her lower stomach muscles. But all these surgeries are taking a toll on her family. All the bills have put her family in serious debt, and her husband is now working 3 jobs in order to pay off the tab for all her plastic surgeries. They also refinanced their house in order to be able to pay for her surgeries. And now Cheryl wants liposuction in her legs. Her husband threatened to divorce her and take their children if she goes through with the liposuction. After hearing Jenny's story, Cheryl realized that she had a problem, and the surgery wasn't worth losing her family. She didn't want to take that risk, and she needed to quit. Now, treatment options for body dysmorphic disorder vary. Like I said before, it's not curable, but the treatments can help to control some of the symptoms. There are 2 main forms of treatment when it comes to dealing with body dysmorphic disorder or cosmetic surgery addiction, and that's counseling and antidepressant medications. Group therapy and individual CBT have been proven effective in helping people with BDD as well. Now, the medications that are used for treating BDD belong to a group called SRIs. They help to reduce obsessive thoughts such as, I need to fix this, this is wrong, I need to get this surgery done because it'll make me look better, or compulsive behaviors such as, I know I don't have the money for it, but I'll figure out a way to get it, and I'm getting this surgery. Now, the FDA limits the dose of SRIs to 40 milligrams a day. However, individuals with BDD usually need higher doses than this. And no medications currently have FDA approval for treating BDD. But they still use medications for treatment anyway. It can take as little as 2 to 3 weeks or as long as 14 weeks for the medication to start working, and it must be taken every day in the appropriate doses, not just when you feel compelled to get a surgery or not just when you start thinking negatively about yourself. You have to take it every day in order to see any type of results. It's recommended to take the medication for 3 to 4 months to see if it works for any specific individual. However, we all know that there is no one-fix-all cure for any addiction. I looked into a study that discussed a group treatment for a group of young women dealing with BDD. And this study stated that these elements should be included in a group for treatment of BDD. Informational interventions that detail the nature of BDD, such as letting them know what this disease is, what this mental illness is, and how it is impacting their lives. It'll give them some type of insight on why they're doing what they're doing, and give them a better idea of what they can do to help themselves. Self-monitoring of both thoughts and BDD-related behaviors, such as comparing yourself to others, always thinking something's wrong. They need to record that. They need to understand what this disease is doing to them. They need to be able to see it on paper. It's one thing to think about it, it's one thing to talk about it, but to record it and see it is a whole nother story. Cognitive restructuring that targets negative, self-depreciating, and self-defeating cognitions that are associated with BDD and depression. Basically, taking the negative and turning it into a positive. Don't always look down on yourself. Don't always belittle yourself. Find a way to take these negative things and transform them into a strength, into something positive. Exposure to mirrors, avoided situations, and activities. People with BDD usually try to avoid social situations because they don't want other people to see what they see. They might feel like they're hideous and they don't want to put themselves in situations where others can call them hideous as well. They don't want to look at themselves. They don't want others to look at them. They just avoid themselves, period. Group treatment should bring them out of this, put them in situations where they have to be around other people, bring them around mirrors so they have to look at themselves. Now, on the other side of the spectrum, prevention of BDD-associated behaviors such as mirror checking, comparing self to others, and skin picking. While some avoid mirrors completely, avoid looking at themselves completely, others cannot stop. So if you have a person that cannot stop looking at themselves, tell them, look at yourself in the morning, don't look at yourself again until you go to bed. Those types of things. Avoid checking the mirror, checking their appearance throughout the day. Avoid comparing themselves to others because no two people are alike. You can't be someone else because you're just simply not them. You're you. These groups should be small groups between 4 and 5 people, and they should meet weekly for at least 12 weeks with 90-minute sessions. I hope you all enjoyed my online presentation about body dysmorphic disorder, cosmetic surgery addiction, and treatment options for the both of these.